everyone, welcome to our YouTube channel Nursing Codebook. This side Karishma here. I am a psychiatric registered nurse and today I am going to discuss about elements of administration. In my previous video, we have discussed about the administration definition and meaning. If you have not watched that video, I have mentioned a link of the video in my description. You can go and watch. And if you are new to our channel, then you can subscribe and like our videos. So to understand elements of administration, there is a simple mnemonics which will be very useful for you to remember it. The mnemonics is pause, D, call. The mnemonics is pause, D, call. Okay. P stands for planning. P stands for planning. Now what is planning? Suppose कल आपका बर्थडे है, so आज से ही आप प्लान करोगे. You will decide in advance कि केक कहाँ से लाना है, बर्थडे कितने बजे सेलिब्रेट करना है और किन किन को बुलाना है. Likewise, in hospital setting, the hospital administrator will decide in advance that how to do it, when to do it, and who all are the members are involved in doing the particular task. So what is planning? Planning means you are deciding in advance what to do it, when to do it, and who all are the members are involved in doing the task. Example, a nurse manager will prepare a duty roster for a nurses, ensuring that 24 hours patient care. So I hope you have understood about planning. Next, O is organizing. O is organizing. Now what is organizing? Organizing means allocation of resources like time, staff, okay, and space, and why it is needed? To carry out the plan. To carry out plan, the allocation of time, allocation of staff, and allocation of space is required. Example, nursing supervisor will assign a specific room, specific bed to a nurse based on the patient condition. Suppose a patient suffering from a critical condition. So nurse or supervisor nurse will assign a ICU room or the setting to a nurses. Right? So based on the patient condition, the nursing supervisor will assign a specific room, specific bed to a nurses. I hope you have understood organizing. Now next one is S. So S stands for staffing. What is staffing? Staffing includes hiring, training, and assigning a task. So three things will come under staffing: hiring, okay, training, and assigning task. Assigning task. Example, a new nurse who has joined to a hospital. Now nursing supervisor will ensure that proper training and orientation will be given to a nurses and proper assignment of task will be given. Right? This all things will come under staffing. Now what is D? D stand for directing. D stand for directing. What is directing? Directing include motivating, guiding, and instructing subordinates so that maximum output can be achieved. Now for example, just to understand, in a ward before starting a shift, the nursing supervisor or the manager will motivate the nurses so that maximum output and more progress can be seen in a patient. So these things will come under directing. Now next, C stands for coordinating. C stands for coordinating. So coordinating means ensuring all the departments are working together, right? Because in hospital setting it is very much important to have a better coordination in all the department, whether it is medical, nursing, lab, OPD or pharmacy. So coordination is ensuring all the departments are working together and smooth running facilities in hospital or healthcare. The coordination among the different departments is necessary. Next, what is O? O is controlling. O is controlling. Now what is controlling? So basically controlling is like making a note whether the work is happening on a proper basis or not. Suppose a nurse is providing a certain procedure. Now nursing supervisor or the assigned person will make sure that proper standard guidelines or the procedure has been implemented while doing a procedure. If not, if any correction or if any error is found, then the correction can be provided. So these all things can come under controlling. Controlling is what? Observing the things, whether the work is happening as per the plan or not. Example, if any procedures is done or if any task is done by a nurse, like nursing documentation when she has given the administration, suppose time is missing. So if nurse manager can see, if nurse managers finds out those mistakes, so she will rectify it and she will tell the nurses to not to do the mistake. So these all things will come under coordinating. Now R stands for reporting. R stands for reporting. So reporting is communicating about the fact and informing to a higher authority. Suppose a nurse who is working into a ICU setting and she is providing a care to a patient, but she has suddenly observed some symptoms in a patient, right? So what she will do? She will inform to a doctor immediately. And after the doctor communication, whatever the doctor has given a prescription or the drug which needs to be done, the drug which needs to be administered, that all things she will document it. So these all things will come under reporting. Reporting is you are informing to a supervisor or you are informing to a higher authority about the incident and you are recording it, what was the communication which you have given to them and what they have communicated to you, right? And B stands for budgeting. B stands for budgeting. So what is budgeting? Budgeting means allocation of financial resources. So every department, each department in hospital setting and the head of the department will prepare a budget for their respective department. Like what all the material required, how many staffs are required in a one department and what all the other things are required. So these all things will be prepared by a HOD and this preparation and the allocation will come under budgeting. So I hope you have understood about the elements of administration. Let us do a quick revision to understand more, right? To remember elements of administration, you can use a simple mnemonics which is PAUSE, D, CORD, right? So P stands for planning. Planning is deciding in advance what to do it, when to do it and how to do it. Example, nurse manager can prepare a duty roster for nurses for the different work allocation so that the 24 hours patient care can be provided. Now what is O? O is organizing, allocation of resources, time and space so that the plan can be carried out. And S is staffing, which includes hiring, training and assigning a task. Now directing, motivating a client or motivating a resource person so that more work output can be achieved. And what is coordinating? Ensuring all the departments are working together for a smooth function of a organization. And what is controlling? The making a I so that the work is happening on the proper basis or not. If not happening, the proper corrections can be done. Next, what is reporting? Reporting is informing about the facts to a supervisor and also to the higher authority, and each and every communication which has happened on the reporting side, it should be recorded. Now, what is B? Budgeting. Budgeting includes the allocation of the financial resources and everything, right? How many materials required, how many resources are required, these all things will come under budgeting. So I hope you have understood about the elements of administration. In the next video, we will see about the philosophy and purpose of administration. So any video suggestion or any topic which you are still struggling, and if you want to understand in a simple way, comment below in our comment section which topic you need a help. Like and subscribe our video. Thank you.